Hello everyone. In this new series of educational videos, we will be learning about the important assessment and treatment techniques to manage musculoskeletal conditions based on the Janda approach. Janda approach was developed by Dr. Vladimir Janda in the late 1970s and early 80s. Dr. Janda was a Czech neurologist, and after completing his degree in medicine, he also did a certification in physiotherapy. Dr. Janda was one of the first physicians who combined therapy and medicine in a hands-on approach, and he developed this passion to study body movements rather than individual muscles. In Janda approach, it is emphasized that it is more important to test a muscle function rather than its strength. That is, even if a muscle tests normal or is having grade 5 on MMT, then this does not guarantee that the particular muscle will also have normal functions. It is quite possible for a normal or strong muscle to have an altered firing pattern or the timing of contraction. Now, the classical example to understand this concept is that of the serratus anterior muscle. Many a times in patients who complain of shoulder pain, on movement analysis, it is seen that the scapula on the affected side has a delayed setting off during the shoulder abduction and elevation movement. That is, when compared with the normal side scapula starts participating in the elevation movement earlier as compared to that on the affected side. And this can result in the altered glenohumeral rhythm, subacromial impingement syndrome, pain, and so forth. So, on examination, the serratus anterior can test strong, but still its firing pattern has altered, which leads to production of pain patterns. Now, such impairments of muscle functions are termed as functional lesions or pathology by Janda, and such dysfunctions can manifest in the form of muscle imbalance, reduced somatosensory or proprioceptive input from the affected joint or muscle, as well as the faulty movement patterns. And this is what a therapist who practices Janda approach looks for in their patient while their diagnosis making. So, Janda approach can be defined as a neuromuscular or a sensory motor treatment approach that focuses on managing musculoskeletal conditions by identifying and treating functional lesions. And these functional lesions can be, as was mentioned before, in the form of muscle imbalances, altered proprioceptive inputs, and faulty movement patterns. So in this whole series, we are going to learn how to identify muscle imbalances and correct them, how to restore the faulty movement patterns that are present in the body, and also how to train the somatosensory system so that we can have normal afferent discharges to the nervous system, which can in turn produce the purposeful motor efferent output, and we can have a good neuromotor control in our patient. So when we say that Janda is a neuromuscular or a sensory motor approach, this means that the basic underlying concept of the Janda approach is that both the musculoskeletal system as well as the nervous system are interdependent on one another. And the musculoskeletal system is at both the giving and the receiving end with respect to the nervous system. At all times, for the maintenance of posture as well as for the production of purposeful movements, there has to be continuous afferent discharges from the musculoskeletal system, which are received and interpreted by the higher centers, that is the nervous system, and in response to those discharges, there are efferent motor output produced, which are again received by the musculoskeletal system. And this afferent and efferent connection and harmony is very important in the maintenance of normal motor functions. Now, whenever there is going to be any alteration in this sensory motor interaction between the afferent and efferent system, then it is going to give rise to the production of functional lesions, which are to be assessed and treated using the Janda approach. Janda found out that there is characteristic pattern for the development of muscle weakness and tightness in the body, and this in turn gives rise to muscle imbalances. Muscle imbalances then give rise to pain and pathology within the musculoskeletal system. Muscle imbalances have been considered by Dr. Janda as one of the most important causative factor for the production of recurring and chronic pain problems. Now let's understand this. Dr. Janda says that whenever there is going to be muscle imbalance, then this is going to lead to the abnormal joint biomechanics over the area where the muscle functions. And as a result, there is going to be structural damage not only to the joint but also to the periarticular tissue. This damage then in turn is going to lead to pain and inflammation, and as a result of pain and inflammation, there is going to be altered proprioceptive inputs or altered somatosensory function in that particular region. And this further is going to lead to muscle imbalance and abnormal joint biomechanics. And this vicious cycle will keep on going and will cause recurring pain and chronic pain conditions. Dr. Janda pointed out that these muscle imbalances occur as a result of lack of movements through regular physical activity or exercise. Or there can be instances where there is lack of variety of movements, as is seen in repetitive strain injury disorders. So muscle imbalances are more prone to occur in those individuals who live a sedentary lifestyle or who work in only a typical posture and repeat a particular movement throughout the day. Physiotherapists who are trained in the Janda approach focuses on evaluating the musculoskeletal problems through posture and gait analysis, balance assessment, assessment for the muscle length testing, and finally assessing the coordinated muscle action. And these four important components of Janda evaluation we will be covering in detail in our upcoming videos. Similarly, we will also learn the important concepts, strategies, exercises and techniques based on the Janda approach that focuses on normalizing the functioning of the peripheral structures, correction of muscle imbalance, and also to strengthen the central nervous system and improve motor programming by proprioceptive training. So this was all about the basic introduction to the Janda treatment approach. In our upcoming video, we will get to know and learn about the Janda's chain reactions. So see you all in our next video. Till then, keep learning, keep sharing, and stay connected.